Have a look at these two big vessels on both sides of the thyroid gland. What are they? This is our carotid sheath, and you see now how close the carotid sheath is to the visceral compartment of the neck. In fact, we have just two layers of the deep fascia of the neck which separates them. The smaller vessel in this picture is the common carotid artery, and the larger vessel here is the internal jugular vein. And if you look attentively on the lateral side of the neck here, we have one more tiny vessel here, right? And this vessel is the external jugular vein. The muscle which divides these two veins is the sternocleidomastoides. Now let's scroll up. You see some cartilages of the larynx in the middle, the thyroid cartilage, and the cricoid cartilages behind. And at the level of the upper border of the thyroid cartilage, the common carotid artery is bifurcating. But before that level, have a look how larger this artery becomes. This is the area known as a carotid sinus, the baroreceptor of the carotid system. And just above, you see the common carotid artery bifurcates into the external carotid, which is located anteriorly and closer to the midline, this level in the neck, and the internal carotid, which is very close to the internal jugular vein and is located a little bit posteriorly here. It seems to be unusual that the external one is located closer to the midline, but if we scroll further up, just focus your eye on the external carotid artery, and you're gonna see how it turns laterally and reaches the parotid gland just behind of the ramus of the mandible, and here it bifurcates again. You see two tiny dots behind the ramus of the mandible. This is the area where our external carotid artery gives its terminal branches, the superficial temporal artery and the maxillary artery. The maxillary artery, it enters the infratemporal fossa, and you see it right now here, and then it runs through it, giving some branches. And you remember the third part of the maxillary artery, the termination of this artery, it enters the pterygopalatine fossa. And now you see how exactly it happens. The artery inside of this tiny space in the middle is the third part of the maxillary artery, and you even can see how it enters eventually the nasal cavity. Okay,